All right, hi everybody. It is Monday, and we are going to start off with health in the news. According to my list, and I have a couple of lists that are brewing here, I think we have four presenters today, and today is the 26th. So we have Justin, Marissa, Vanessa, and Jeffrey. So Justin, do you want to go ahead and go first?
Sure. All right. Can everyone hear me?
Yes.
All right, fantastic. All right. So, hello everyone. My name is Justin. The title of the article that I was looking into is called "Is it safe to eat at indoor restaurants during COVID-19 and what you need to know?" This was published on 2 days ago, October 24th, 2020. And I'm going to start with an excerpt from a claim from the CDC. It says the U.S. Centers for Disease Control and Prevention released a report in September that found that adults who tested positive for COVID-19 were 2 times more likely to have eaten out at a restaurant in the 2 weeks before they got sick. All right, and then leading into the discussion, this article discusses the associated risk factors for dining both indoor and outdoors for newly reopened restaurant businesses. There's a number of recommendations that the article talks about as to what you should be cautious of if and when you decide to dine out. Um, Such recommendations, things we should be considering include like the awareness of which restaurants or places require a mask upon entry and exit of the establishment, the mindfulness and distancing between seating arrangements, and with whom you decide to dine with. And if you do choose to do so, to eat with those within your quarantine pod, specifically those you've been in close proximity with throughout this whole pandemic, and like family and people have tested negative and things like that. One thing that I didn't find as I was reading and going through this article was a newly implemented step that few locations or a few restaurant businesses have been integrating into their work is the concept of surface tracing. And surface tracing is like when you sit down, you write down your information, like your name and your number, and then it's like a little contact card for in the case that someone does report being ill after eating there, like someone who works there or a guest, then they have the ability to track within the past 2 weeks and contact people who were there in the restaurant. I chose this article for a few reasons. My primary reason is the connectedness and the firsthand experience that I have in the matter, because I work in a restaurant. Even now, we newly reopened, and I'm going to choose not to disclose the name of the restaurant. We have now opened indoor seating, which also includes a limited space on a patio for outdoor dining, which is where like we want people to sit, but we only have about like, I would say 7 or 8 tables on outside versus like 40 on the inside. I work a few days out of the week. However, with reduced hours mandated by the current state ordinances of California, it makes it kind of hard and like difficult to even come into work. And then my secondary reason for choosing this article is because COVID is still a prevalent matter in our lives, and two, it's relevant to all of us, as I'm sure we're beginning to return to quote unquote normal state of life, including activities such as dining. So I found this article scrolling through Google News under the health category. I did my own research into the website. This article comes from cnet.com, CNET, and I did look into the author of the article as well. This was sourced from a Miss Mercy Livingston, who is a health and wellness writer. She's certified integrative nutrition health coach. I do believe that the article in its entirety is very reputable, as Mercy Livingston has also written articles for other publications such as Well Plus Good, Women's Health, Business Insider, and Prevention.com. And she's a contributor to the publishers of CNET. However, she's not like an employer, so they don't pay her to be writing for them. She's just a independent writer. And that's it. That's my health in the news. You have any questions for me?
I have a couple of I don't know if they're questions, but I want to open it up to anybody else before I do. So questions, comments, thoughts from anybody about this? I mean, obviously it's very timely.
I have a comment because I work in a restaurant too, and I don't know. I feel like, well, one, like I don't even really go out to restaurants to eat. I always do takeout, but I feel kind of hypocritical because like I work in a restaurant and I'm surrounded by all these people.
Yeah,
So thankfully we get to wear like masks and gloves and stuff. But but we've had like a lot of employees get COVID. But I feel like my work has been very irresponsible with how they handle it. And I don't know, it's just weird working in a restaurant right now.
definitely. It's really scary sometimes because a lot of people don't comply and then they get upset when we ask them to wear a mask and if they're going to the restroom to have a mask on while they're passing by other customers. It's a very frustrating thing to deal with.
Yeah, I agree.
Well, and you're not setting the rules. You didn't make this
Yeah,
happen. So
exactly.
it's frustrating to me when I see customers in a restaurant complaining to the servers or the hostess or the managers or whoever. It's a public health issue. It's not just because we want to inconvenience people. And that's the frustrating part that I find. So for those of you that do work in restaurants, I commend you because it's a challenge right now.
Yeah,
Yeah.
I've had a few Karens who have called me some vulgar names in the past few weeks
Wow. And that's
for
inappropriate.
what we have to do.
Yeah. I remember early on, I was at an outdoor restaurant in Oceanside, and there was a family that came, long story short, and they were arguing with the surfer about COVID being all a hoax and we shouldn't believe it and it's all political. And I know, and it's very frustrating because it's, the server is just looking at them like, I'm just doing my job. I get paid very little to hear your complaints right now, and I just want to move on. And I just saw the look because I was a server and a bartender for years and through college, and so I can feel your pain, and I have no idea what it's like to have everything on top of what you're doing and then COVID. So I think that was a really timely article. I saw, when your posts come in, I get an email and I saw all of your posts today, and I'm just very interested to hear what you guys have to say because it's challenging and you're doing the best that you can. That's all we can ask. So thanks.
Thank you.
You're welcome. All right, who do we have next? Marissa.
Yeah, hi. So my article's name is Heart Attacks Increased After 2016 Election and How to Avoid a Repeat This Year. So the article was published recently on October 16th, and the article mainly talks about how the election puts a lot of stress on voters. Specifically, the health issue we're looking at is heart issues. So according to the article, a new study from Harvard School of Medicine and Kaiser Permanente. In 2016, a few days after Trump was elected, the hospitals had a high increase in people checking in. And specifically when they were checking in, they had, it's called acute cardiovascular disease. And this study specifically looks at a Kaiser Permanente's in Southern California. The article said that the increase of stress and acute cardiovascular disease was 1.62 times higher than after the 2016 election than 2 days prior to the election. So it was like an increase of people checking into the hospitals. This election this year that's coming up could do the same thing, researchers are saying. The stress related to the 2020 campaign is supposed to be even greater, according to APA. The article said ways to decrease the stress was to decrease the amount of times we go on social media, to not be so fixated on the election and all the news going out. It also said to take a walk and be in nature just to like fully de-stress from everything going on in life too, because of COVID as well. And spend some time to yourself, like focusing on your health, your physical, your mental health. A cool quote I found was from Lynn Mufka. She has a PhD, and she said that accepting what we can't change and focus on what we can control is a huge thing to look at the issue when it comes to stress in the election. So this article should interest many people, specifically men and women who are at higher risk for a heart attack during the election time. However, with the upcoming election, I think everyone should be aware of how much stress the election actually puts on people. We must understand that stress can trigger changes in health, and especially during voting time. So basically, this article talks about the high correlation between stress and election. I found this article on the website Healthline. My specific topic, I think, is reputable because it was reviewed and cited by many doctors, PhD professors, and many studies have been conducted from the research. So yeah, does anyone have any questions?
Thanks, Marissa. I've heard this before, and I'm not surprised. And I don't know, I'm just curious. How many of you, I'm curious about your thoughts on this. So let's go over to the participant section. I'm going to do a quick little poll here. So yes or no, do you think that this election process and everything surrounding it has been stressful? Yes or no? Yeah, that's what I thought. So it's stressful for us. And I think that, and I would imagine that for a lot of you, this is really your first big election that you've really paid attention to, you've been invested in, maybe that you're even able to vote. You know, there might be a little bit of some age difference here, but for the most part, I feel like I don't even know what to say. It's just too stressful. And so I'm not surprised at this data. And I'd heard this before, but I would want to know a little bit more. I mean, obviously stress is related to that, but there's got to be something else that goes along with it. I don't know. I'm just curious about anyone's thoughts.
Well, I think just the whole process with COVID and everything is just getting like really stressful because people are just used to lining up at the, voting locations. And now it's like, do I mail it in? And like all these like different changes. And I think change is very stressful for a lot of people.
Yeah.
Yeah.
I think that's a really good point. And it's funny, when I was asking that question, I had not even had that in the back of my mind, but you're right. It is change. And even though they say it's safe, is it safe because of the things that you hear, right? I mean, who knows? And then just this morning, I see that there was like this camera that saw some man setting fire to a ballot drop box area. So if we don't have enough stress going on already, I mean, can we just get on with some of this stuff? And I feel like let's move out of 2020. So and I'm thinking long term, but yeah, I think that you have a lot of good points. Anybody else want to tag on to what Mike said? Because I think that's a good additional point to make.
So I just voted last week. I did do mail-in, but it's like I don't mind mail-ins, but then you hear about all the, oh, it's not going to get counted because of XYZ, or I don't know. It's like, because then it just adds on more stress. You're like, I'm trying to vote already. Now you're saying that if I mail it in, then no one's going to count it, or what if it doesn't get there in time, or, and stuff. And
yeah.
I don't know, but yeah, like this is like my first, I guess like my first real election where like I'm actually like following it and stuff, and it's crazy because I'm like, is this how it always is? But then I'm like, no, I don't think it is. And then watching the debates, I'm just like, what the like,
this is not how it always is.
Yeah, I'm like, dang, stuff is crazy. But.
No, this is a circus. This is a tried and true circus. That's the best way I'm going to say it right now. I think you all know what I'm thinking.
Yeah.
Yeah, there is a way to track your ballot, and I don't have that information with me at the moment, but I will find it on break. And if you have that little thing that you tore off on the top of your ballot, you have a number or something that corresponds with that, and you can track it.
I didn't.
Okay.
But I'm sure there's other ways to figure it out.
Yeah, there are totally, because that's something that many people don't remember to tear off.
Yeah.
Yeah.
I didn't even realize that like our signatures are supposed to match the ones on our driver's licenses. Like I didn't know that. So now I'm like, oh, so at the last election my vote didn't matter.
Yeah. Yeah, so that's why it'll be good to track it. So I'll find that information on break and then I will post it. Okay. And I agree with you, Fernando. We are the comedy to the rest of the world, for sure. All right, so we haven't done this, and I always forget to do this for the first person, and we always end up doing it on the second person. So applause for both Justin and Marissa, because those were really great articles. Vanessa, are you ready to present? You know what, and Vanessa might not be here today. Okay, so Jeffrey, are you ready, Jeffrey?
Yes.
Okay, take it away whenever you're ready.
All right. I found this article on Healthline, and it says, why is it important to get your breast cancer screening done, even in this pandemic? The American Association of Cancer Research published 2 studies that in July, there has been disruptions in regular breast cancer screenings. Experts are saying that the process now are put in place are to maximize safety. The healthcare facilities are now more prepared. Hospitals and doctors' offices are the safest place to be, I guess. They're taking fewer patients at one time. Everyone's getting their temperature checked, wearing their gowns. And then the article goes on and says that they want to encourage people to go in and book their appointments and get their regular screenings done. If you have any symptoms or signs, changes to your breast, discharge, any redness, see your doctor immediately and be persistent. And yeah, if you have any like family history of breast cancer, make sure you're very on top of that as well. I checked the, I guess, publisher or if it's a reputable source. And yeah, the writer has been writing for Business Insider. And yeah, and there was another study in this article says that there could be a potential increase of 33,000 cancer deaths in the US because of the lack of early detection. And these studies were looking at all types of cancers. And the delay in diagnosis will likely lead to more advanced stages and poor clinical outcome. And yeah, this article might interest, your mom, your aunt, your grandma, and yeah, breast cancer is always relevant, and yeah, that's all I have. Any questions?
Thank you, Jeffrey. That was really good info. And I've been hearing that a lot of people are not doing their preventative screening. So I think that's a really good reminder to make sure that we're still doing that. And when we look at all of the unintended consequences of COVID, right? There's the obvious consequences, but there are so many unintended issues that we are going to be dealing with for years to come, just from, this 1 year, hopefully, hopefully it's not too much longer, but it's crazy. So doctor's offices, I've been to a couple of appointments and they're doing the temperature checks. They're doing all of the possible preventative measures, asking those questions. It's really hard for us to know if we've been near or around, obviously around other people who've had COVID, if we've been exposed, if we don't have those symptoms. So we do the best that we can, and that's all that we can ask. So I think that was a really good reminder for a lot of us. And the other thing I would like to add to that is it's not just women, you know, and obviously we don't have a request or requirement for men to go in for prevention. It happens more so to women, but men get breast cancer too. And so if there's ever a question about, you know, oh, there's a lump or something doesn't look right, something doesn't feel right, you know, make sure that you go in and get that checked out too. COVID aside, it's really important because some cancers can advance very quickly.
Right. Like my friend, this past like summer, he went in and or he got sick for a while. Didn't know what was going on. He went in and they found like a lump on his testicle, and then yeah, they were able to catch it. He's doing radiation, so it's very important to go get your screening done. So yeah, definitely.
Absolutely. Absolutely. If something doesn't feel right, you know your body, you know, and so take advantage of, if you know, the medical system when you can. I don't mean that in a bad way, but you know, if you have the opportunity, get it checked out, because things can happen too quickly. So thank you for that. Good information. So applause to everybody. Good job, everybody. Thanks, Jeff. Okay, so I wanted to take a few minutes and reflect on some of the comments that you all had in the course evaluation. And I haven't had a chance to read through everything, and I have some things that have generally come up, not only for this class, but my other classes as well. And I just wanted to spend a little bit of time on that to address and kind of define why things are sometimes the way that they are, or know that I'm understanding what you're saying. So some of the things that came up in the evaluations, number one, were that, you know, 3-hour lectures, kind of long. I agree completely. We do a little bit more interactive and group work in this class, so I didn't get that comment as much as I did for my other course. But, you know, we only meet every other week, and so that's part of the reason why we end up staying so long sometimes. Some of the other comments were that there were odd times for when things were due. And part of the reason for that is some of you like to work late at night. Some of you, you know, want to get things done last minute. And because our class starts at 12:30, I wanted to give you the opportunity to be able to submit until the day of at 12 o'clock, for example. So that's my reasoning. Sometimes I have you do things by midnight on a Sunday so that I can maybe look at them Monday morning before class and then comment. So that's the reason for that. And then a lot of you had some comments, some pretty strongly thoughts, some strong thoughts and feelings about the group work. And I get it. I know that group work is not always fun, and there are some inherent challenges with that. But, and I think I mentioned this on the first day of class, but the reason that we do group work in this course is because we have topics that I want you to work together to present to a group, right? You're presenting to your chosen or your selected audience. And you're going to be working with people in the workforce. When you go out, you know, obviously if you have jobs now, you know that you're working with people, you're going to be doing group projects potentially, but it's how to work with those individuals that we're trying to get you to prepare for. So you're always going to have the one that, you know, takes over and does everything. You're always going to have the person that doesn't follow through on anything. You're always going to have kind of everything in the middle. And it's getting the experience to work with that makes the biggest difference. So I understand your concerns about group work, but in this class, because the majority of what our focus is on, at least at the end of the semester, is coming together and presenting topics that you've researched, that's really the crux of what we're doing. And I have chosen to do a lot of the health background, because I know some of you have mentioned that you really didn't have any health classes to, you know, prepare you for this class, which is why we're doing that. So those are just my thoughts. And what I thought we would do, so the schedule today talks about presentation prep, and then we also have alcohol, drug, and tobacco use. I don't know that we're going to get to that today, because I think it's important that we focus more on the work that you're doing right now. So you all submitted your infographic. before class, I took a quick peek, and I very, very briefly took a quick peek, and I thought they all looked really good. But what I thought we would do today is, at least for the first part of class, each group is going to review someone else's infographic and provide comments. And then your respective group will get those comments anonymously and be able to modify any updates or things that are suggested. And then I'll open up the Dropbox for you to resubmit, by tomorrow night. And that way you'll have a little bit of wiggle room to get some others' feedback, because when you look at something for a really long period of time, it starts to look like there's no mistakes, or there's nothing wrong with it. But I want another set of eyes on these before you submit. And then I think that would be useful for you too, to see what other people's infographics look like. So any thoughts about that? Comments, questions? Okay. All right. So what I have done, I don't know how this is going to work, but I'm going to try and figure it out. I am starting to build your breakout rooms. And in each breakout room, I'm going to give you a infographic. And the infographics are just labeled based on the letter that the infographic falls on the list of people who are doing what. Your group will provide comments to the people who created the infographic, and I will submit them to the group anonymously. So for example, Jasmine and Mike, I don't think you guys are in the same group, are you? Just curious. No? Okay. So, if Jasmine is reviewing Mike's infographic, then I'm just going to say, hey, Mike, this is what your reviewer suggested for you. So that way you guys aren't going to feel bad for making comments. But I want you to go back and look at the requirements. What is required to be there? Because at quick glance, some of you did not include references. At quick glance, there were a couple of things that may have been missing, or maybe it was too wordy. So really look at it with a critical eye and think about the audience looking at this, and would they be interested? What comments or critiques could you give them to improve this? And that's what I want you guys to do. Okay. All right, so I'm not really exactly sure how I've been saving the documents, and I will give each respective breakout room a document. I may have to email it to you so that you can open it and then share it with the group. So why don't we take about 5 or 10 minutes. Let me do that in the background. I'll get everything all set up, and then we'll come back. I have 1:05 on my clock right now, so why don't we come back at 1:15? And then we'll start that process. And then after that, we're going to come back and we're going to start talking about presentation prep, because that's the next big thing that's coming up. So we're not done after the infographic thing, but I'll give you guys about 15 or 20 minutes to review the infographic, talk about things that you want to add or modify, and then we'll go from there. So let's come back at 1:16, because I'm talking through our little break here, and I'll break you guys out into rooms. So I'll see you guys at 1:16. All right, so I did receive a few of your emails, and I wanted to check in and see what your thoughts were about this experience. Was it helpful to look at other people's infographics? Did you feel okay giving feedback? What were your thoughts?
I think it was a good activity. It just we got to see the strong points and what needs to be worked on in other groups, and it made us think of like, oh, what do we need to change in our own? And just like seeing the difference in formatting from group to group, or at least our group compared to theirs. Yeah, I think it was helpful for both parties.
Good, thanks, Mike. I agree. Anybody else? Feel free to use the chat if you don't want to speak up. But that's my point. That's exactly what I want you to do. I want you to see, different infographics and not at the last minute, right? I want you to see what other people are doing. Not that you need to copy what they're doing, but everyone's very creative. And like I said, I briefly looked at all of them, and I was really impressed by how creative you all were. And so also being able to critique, you look at it differently when you're critiquing it and providing comments for someone else. So it's kind of that learn by teaching method, which I think is really important too. Anybody else want to add some thoughts or comments?
Just a question. Are you going to be sending us feedback on top of what other people send us?
So no, yes and no. I only want to be able to grade them once. And so the feedback that you are going to be given today, I will send out in an email after class. Then I reopened the Dropbox for you. So it will now be due on Wednesday at 11:59. So you can make those changes, and then I will grade them. But it will be similar to all of the others, where if I have things that I really want you to change, I'll kick it back, I'll ask you to make those changes, and then I'll enter a grade. Yeah. Okay. All right. So we have 3 of 4 aspects down. We are in the middle of the semester. We've done the health behavior that you are planning to use, right? The health behavior assignment. We've done the lesson plan template. The third aspect was the infographic. Now we have to turn our attention to the big guns, which is the presentation. Okay. And I want to make sure that we are all on the same page and talk about presentation skills, because there's things that I'm sure you all love with presentations and things that you don't. Really quick segue here, completely off topic, but before I forget, I did put the Track Your Ballot link in the chat. So if anybody's interested in that, make sure that you check the chat, click on that link, and then you can, just do your research there. Okay, so presentations. Now, as a reminder, the presentations that you are going to be creating and giving will all be on Zoom. Right? So we're stuck in Zoom zombie land, and you'll be presenting via Zoom, just like you do for your health in the news topic. But as a group, you'll need to be able to make sure that you have transitions done appropriately. So you're going to need to practice. And by practicing, that means everyone in the group, and I'm going to stress this again, everyone in the group needs to participate in these practice sessions. You are not doing this on your own. You're doing this as a group effort. And so I have heard from some groups that partners are not getting in touch, and that they're not submitting the work. And so therefore the group leader or other people in the group are taking on that extra work. When that happens, your grade no longer is a group grade, it's an individual grade. And I'm very concerned about the lack of effort that I've been hearing from some groups. So I'm kind of giving you a warning shot right now for the rest of the semester. You need to participate. Your group leader will send out times that you need to try to be available. Of course, you have to coordinate and make sure everyone is available. They're just not going to dictate times. But you need to come together to be able to prepare and practice for this presentation. The presentation that you're giving is going to be presented to the group that you are fictitiously presenting to, basically. So for those that have diabetes, you're going to be presenting to your age group, and I don't remember exactly what that is. The fall prevention group, those people in your audience are going to be the elderly, because really that was the focus of your group presentation. So you have to talk to us as if we are the ones learning about this for our own benefit, not college students. So that's why I want you to think about this a little bit differently so that you're prepared in how to develop your information. And I looked at a lot of your activities, and for some of you, I kind of kicked it back and I made some suggestions for the activities that you're going to be doing or the assessment. And a lot of students will use a Kahoot for an assessment, right? Have you guys all heard of Kahoot before? I'm assuming a lot of you have used it. Maybe you haven't, but it's an app that you can use to poll individuals based on the questions that you're asking. So you as a group will create a Kahoot or some other type of question, maybe a Quizlet or whatever, and then you will use that in your presentation as an interactive activity. This is just one example. I'm only giving you one. I want you guys to think outside the box. What I will say about the Kahoot is you're there to teach your audience, right? So if you were to say, okay, Emery, and I'm just putting you on the spot because I see you in my screen. I see Mike and I see Jasmine. So let's say I'm presenting to you guys and I say, okay, so watermelon is pink, yellow, green, or blue. And then you answer the question and then you come back and say, okay, so watermelon is pink. Yes, that's correct. And then you move on. But there's really not a lot of education there. You're not going back into your presentation and talking about how and why the answer is what it is. So provide some extra information there that helps your audience learn. Well, watermelon is pink because as we talked about in blah, blah, and then you can go on and talk about it that way. So I want you to think outside the box and how would you want to be presented to? So I want to open it up a little bit and ask questions of you. So, and feel free to use the chat as well. What are some things that you have seen in really bad presentations? Or what do instructors do through Zoom that you hate? Feel free
a lot of filler words.
A lot of filler words.
Like those.
It's very distracting, right? Yes. I think that's a great, great comment. So really be aware of the filler words, the like. I have a friend who says, do you know what I mean? After every sentence she says. So it's important to not fill up the space, and it's okay to have silence. Silence is okay. If you're trying to gather your thoughts, if you say, it's very distracting. So that takes practice. And when you know your material, those filler words will become less and less. There's another comment about being monotone. Oh my goodness, yes. So monotone, in case you're not familiar with that, is if you are talking like this the whole time and you are emphasizing only to this much. That's really boring. Nobody wants to hear that. Yeah, so have some energy. You know, I've been told I have too much energy, but I don't know. I feel like I'm trying to keep you guys awake. So there's a fine line, right? Jeffrey has a great comment. These are all really great comments. Reading straight from the PowerPoint. Holy cow, yes. And that's another thing about practice. If you practice your information and you know it, you won't rely on or you won't need to read directly from your notes. Now, the good thing about being on Zoom is right in front of your camera, and I'm just using my fingers here as an example, right next to your camera, you can have little notes. That's great. Even if you were presenting in class, I would allow you a little bit of notes. That's okay, because it's nerve-wracking, right? This is not a comfortable thing for a lot of people. I still get nervous every time I have to come on or when I have to go in front of people. A little bit of nerves is okay. It kind of gets you through. But if you're reading consistently from your notes, I will mark you down in the presentation. And that will be an individual thing. That will not be a group thing. So make sure, again, that you're practicing. It all comes back to practice. Go off on tangents. Josh, I think that one was for me. So go off on tangents or stories that are uninteresting, have nothing to do with what they're talking about. I agree. Sometimes I can do that. So I know that that can be frustrating. And in your presentations, it's not usually likely to happen. However, it's important to be redirected back to the topic at hand. So I think that's a good comment as well. What else? What else can you think of? When you think about lectures, of course, if they're 3 hours long, just being online, it sucks, I get it. But what is it that loses your interest?
I think just like too many words on a slide where people are just overwhelmed with all the information that's like coming out.
Yeah, I think that's good too. So use those as talking points and have the notes, or again, the practice that will allow you to be more familiar with what you have to say. Because when you're talking more naturally to your audience is going to be more engaged. If you're just reading at them, or if they're constantly looking at what the PowerPoint has to say, there's some kind of disconnect there, and it doesn't really allow for it to be a good presentation. Good. Anything else?
I would say like fidgeting,
Yeah.
fidgeting with like your hair, picking at, I don't know, that type of stuff.
Or a pen where you're constantly clicking and then it gets really loud because you're on Zoom, right? The other thing that I think goes right along with that is fidgeting. If you have a laptop or wherever your microphone is, try not to be shuffling papers, because if you're trying to look at notes and you're shuffling papers right where your microphone is, that's going to be very distracting as well. Yeah, so the fidgeting, again, it comes with practice. How comfortable are you with the material? Someone had sent me a message about reading off a huge list of stats. Yeah, and your audience isn't going to care about that either. I think it's important to highlight some of the really maybe life-altering stats for diabetes or fall prevention, things like that. But if it's a whole list of things, there's no need to go into that. And that's partly what your infographic can be for too. So in your presentation, I will want you to reference your infographic. Deanna had a good comment, not engaging the audience through discussion. That's huge. And I think that's a really good comment for everyone. Ask questions of your audience. You don't have to just talk at them the whole time. I know that for me, I would prefer to have engagement. I don't want to just talk at you. And I feel that most of you are like that too. When I talk about my classes to my husband, he says, just tell me the information and let me be done with my day. And he would just much rather prefer not to be engaged in that type of classroom environment. I get it. We all learn differently. However, during a presentation, it's a really great idea to garner feedback. Ask your audience. So what do you guys think about fall risk? And I don't know why I keep going back to that presentation. You can ask questions about nutrition just to get some feedback. And it also eats up a little bit of time too. So that's where that preparation comes from, because you could have a great list of things that you want to talk about, but 20 minutes in, if you're only halfway through, the rest of your presenters are affected. So that I can't say practice enough. Technology difficulties. Yes, technology difficulties with everything that we have going on right now, I get it. So of course, there's only so much that you can do about that. And if there are those of you that have Wi-Fi issues, then perhaps recording your section previously in case you're not able to present is something that I would suggest. So just food for thought, and we can talk about that individually or through each group, so that I want to make sure that you're succeeding and not freaking out because your Wi-Fi connection is terrible. So what about good presentations? What are the things that you love about good lectures, good presentations, things that you've seen in the course of your career?
I like seeing like a balance between speakers, especially like during in-person classes when people are presenting. Sometimes you'll have one person who kind of dominates the entire presentation. So I like hearing all the perspectives of like each of the classmates, and that's like really refreshing.
Good, I agree. I think it's only fair as well, right? because you are going to have some more dominant versus less confident speakers, which, you know, again, that's where it all comes back in together, working cohesively. So I think that's a good point. Jeffrey said the speaker sounds fun and engaging with the audience. I couldn't agree more. And then being able to relate to something in the presentation. And we might not be able to relate to everything, or, you know, even some things in all presentations, but as long as we're trying to make it as interesting as possible, that's all we can do, right? And we may not be interested in COVID. We are, but I think we're sick of hearing about it at the same time. So, you know, what the presenters are faced with, and it's not just COVID, but you have to be creative in how you present that also. So the activities will be really important too. Now, if you want to work with breakout rooms for some, I'm happy to help you with that, because I'm going to have to be the one that controls that, and we'll have to set that up in advance. So don't email me the night before your presentation and say, oh, we want to do breakout rooms. That's not going to happen. I'm going to have to know well in advance so I can set it up. Good. What else? Anything else? And I know it's maybe a little redundant because we talked about what you didn't like and then how to make it better. But is there anything else that you'd like to add for things that you really enjoy about presentations? Short and sweet, right? Not droning on. Okay. Anybody else? All right, how are you feeling about these presentations? Like, what questions do you have? I know that you haven't really started thinking about them, but based on everything that we've talked about so far, what are some of your concerns? What are some of your questions? And it could be asking for a friend. I don't know, just curious.
I'm concerned about how, over Zoom, how we give the presentation. So is it like one person is sharing the PowerPoint and then only like 4 of us talk? Is that how you would do the presentation?
Sorry, I was distracted. I don't know if that was Camp Pendleton or have we just had an earthquake. So if you saw my face, something just happened. Got a little scary there for a second. Did anybody else feel that by chance? No? Okay, maybe it's just me. Camp Pendleton, we're not far from Camp Pendleton, so it could have been their bomb trainings, which always freak me out. Yeah, so good question, Jasmine. And I think that is something you and your group will have to work toward. So in my experience, I think that one person handling the transitions of the PowerPoint is easier than flipping back and forth with sharing screens, because sometimes that can lend itself to technology issues. And if one person has their headphones plugged in, then we can't hear them. There's just things that come up inherently from that. So I'm going to leave it up to you guys. My recommendation is to have a point person, and maybe it's the group leader who is the one that manages the technology. So if you do have a PowerPoint, which you don't have to create, but you'll want to have some visuals, right? Mm-hmm. So you can do a PowerPoint, you can do a Prezi, if you have a video. These are all things that you're going to want to practice through your own Zoom experience. So you're talking right now, or I'm talking right now, and then Jasmine, you came in, and then just a second ago, Mike was talking. So we're not really going to do anything with Zoom other than whoever's talking, they just unmute themselves. But there will be one person that will kind of hold the technology if that's what you decide. But you'll also have to practice with any videos that you might want to show. And that's okay too. If you want to show little video clips, maybe things that you've made yourself, or YouTube clips, something that will really enhance your presentation. What I have found sometimes is that whoever is controlling it, if they're wearing headphones, then let me try and explain this well. If the headphones are plugged into the system somehow, whether it's a PC or an iPad or whatever, then the volume doesn't come through to us. It only goes through the person in the headphones, if that makes sense. So you'll have to practice that and see to make sure that everyone else is hearing. So you all have access to Zoom, and you can create your own Zooms for a little bit, right? You can get a free account. So you'll have to just do that on your own and practice it and see what works and what doesn't.
Okay.
Does that answer your question, or do you need me to go on? Okay.
No, yeah, that answers it. Thank you.
Yeah, and I mean, I can't stress this enough. It's just about planning ahead, preparing, and figuring out what works and what doesn't.
When we do give our presentations, do you want us to be describing what our program is, or do you want us to be speaking to the class as if they are the audience of the program?
I'm going to say yes to both. So yes, you are speaking to your audience as if they were the intended audience. But you'll start out your presentation by saying, you know, hi, I'm Jasmine, I'm Mike, I'm Deanna, and we're here to talk to you today about diabetes education, and our population is this. So your audience will need to know who they're supposed to be, right? And so you're going to prompt them in the beginning by saying, this is who I am. You're going to introduce yourselves. This is who our audience is. And then you can go into your presentation as if you were presenting to that group.
Okay.
Makes
I
sense?
think that answers my question.
Okay.
I had a question regarding the activity portion of it. So for our activity specifically, we have a Jenga set. And since we're on Zoom, not everyone's going to have access to our activity. Can we just hypothetically explain how our activity should be played out?
How would you, what's your group again? What's your topic?
We're smoking prevention.
Okay. So if you were tasked to give this presentation via Zoom, how, and I was your audience, how would you do that?
Okay, that makes
Right?
sense.
That's what I want you to think about. So just walking me through it and explaining how you would have done it if we were in person is probably not a good idea.
Okay.
I would want you guys to come up with a way of involving your audience. And I feel like there's got to be a way of doing that online somehow. There might even be like a Jenga website. I don't know, but maybe you could be creative with that, or even use Kahoot in that way, or some other type of activity.
Okay.
So that was a really good question.
I have a question. Are we adding any new material to our presentation, or are we pretty much just compiling all the information we have into presentation form?
That's up to you. So I wouldn't go too crazy by adding new information. Do you mean from your infographic and your lesson plan? Yeah, I wouldn't go crazy adding too much more.
Okay.
Unless you feel the need. And what I've had are students that they go to create the presentation and then they look back to their lesson plan template and say, oh, no, we need to change this. So that's okay.
Okay.
You're going to resubmit your lesson plan template to me when you submit your presentation.
Okay.
So if that has to happen, I'm totally fine with that.
Okay.
Because in theory, you could be like, oh, no, this is going to be awesome. But then when you go to create it, it doesn't work.
Okay. And then are there specific topics or slides that you want us to have in the presentation, or can it just be kind of how we feel it should be laid out in the bolded headings?
Yeah, as long as you're addressing the questions I'm asking, I don't care.
Okay.
I don't want you to stick to a format, because I want you to be engaging those creative juices and putting your own stamp on it. Because if it were all in line with the same format, I think it would be boring.
Yeah. Right. Okay. Yeah. Thank you.
Yeah. What else? Let's see, I'm going to look in the chat here. So go to participants. I'm going to do a quick poll here. How many of you have used Kahoot in the past? Okay, so a lot of you have used it. And so my assumption, and you know what they say about assuming, my assumption here is that at least one person in each group will have experience with Kahoot. So it's an app that you download, and I will put the proper spelling of it in the chat. So you can download the app, and it's free. You can create questions, and you'll have to obviously input answers. Now, some students will do a pre-quiz and then a post-quiz. So whether they're the same or different, I recommend that they be a little bit different, but it's another activity. So if you want to keep your audience engaged, the only thing that I suggest with those type of quiz formats is that you don't just give the answer and then move on. You have a little bit of dialogue and education for why that answer is the way that it is. Now, there's going to be some obvious answers where we won't need that. But for the most part, if you're asking about statistics and you're saying, okay, what percentage of the population currently has COVID? And 6 months ago, that was one number, and then now it's this number. So just give a little bit of education on that. Okay. I always love the polls because when I look at how many participants there's 36, but only 25 have responded. So in my brain, that means you just put the class on and then you walked away. But you're here and that's fine. I'm glad. So what other questions do you have? This is a really good time to talk about this. This is not going to be our last time discussing it, but I want to make sure that we are all feeling a little bit better because presentations, and I'm going into my calendar here. I'm going to share my screen with you so that you see what I'm looking at. So presentations are going to start on November 23rd. So we've got less than a month before presentations start. Now, today we have on the docket drug, alcohol, and tobacco use, and then planning for instruction, which we've already talked about. And then next week, we have drug, alcohol, and tobacco use. We're going to have a guest speaker next week. So next week's kind of a big week. And I don't know if I mentioned this. I know we talked about a guest speaker, but it's actually my husband. And my husband is coming in. He is a psychologist, and he works in addiction treatment. And he's very knowledgeable in alcohol and drug addiction. So he's going to talk to you all about some of the things I'm not as comfortable with. And I also want you guys to come prepared with questions. And I think it's important to ask him those questions about, for example, Adderall use or alcohol use or withdrawal or the things that we're going to talk about, but be thinking about for questions for him. That's why he's here. And he's really, again, knowledgeable in these topics, and I think he'll be better able to talk about some of the things compared to my limited knowledge, which is basically from him anyway. So he'll be coming next week to talk about that.
I have a question. When will we find out, like, when we'll be giving our presentation? Like, is there going to be a sign-up sheet, or are you just going to assign us?
Well, that's a good question, Jasmine. I didn't mean to cut you off. Did you? Okay. I was thinking of just going in order, A, B, C, D, E, F, G, H. So we'll have 3 presentations. Let's see. I'm sharing my screen with you. Hold on. So just to make it easy, I have 4 days set aside for presentations. We have 10 groups. So that means ideally 3 presentations a day, which may or may not be too much. I did that last semester and it seemed to be fine, but that's all that we have. We don't have anything else that we will need to talk about. So on November 23rd, I think we should just go in order. So A, B, and C, which is stimulant use, smoking prevention, and fall prevention. And then, hold on, going back here. On November 30th, D, E, and F, which is obesity, mindfulness, and then nutrition. And then the next one will be G, H, and I, which is vape prevention, diabetes, and then flu and coronavirus. So that would be December 7th. Then I really don't want to go into the 14th, but what can happen is, so we'll have J go on the 14th. What can happen is life. And so sometimes some presenters have life happen, they're not able to. So I have that extra day as a catch-all, even though it goes into finals week. I think it's important to have it just in case. Now, I'm willing to, if you guys are in agreement, to have 4 presentations on December 7th, so we don't have to meet on December 14th, unless there's a group that is not able to present on their original day. What do you think about that? I'm going to clear the poll, and I'm going to re-ask the question. This is anonymous, and honestly, it's up to you guys. Would you prefer, yes or no, to have 4 presentations on the 7th and no class on the 14th? I think that wins. I think that's a yes. Okay, not one no. So we'll have 4 presentations. It's going to be a long day, but they're all really interesting. And so I think that we'll work it out. Now, I will say as a caveat that if something comes up, we'll have to move the schedules around, and hopefully I won't have to put it on the 14th, but that's going to be a placeholder if we need it. Cool?
One more question, sorry.
Oh no, please ask. This is good.
Well, okay, sorry. So I just want to clarify. So we're going in order of of our group letters, like how we're group A, we would go, okay. And then, my second question was, during our student teaching weeks, there's still health in the news, right?
No.
No, the health in the news is finished by then? Okay.
Yep, so let's see, Health in the News ends on 11/16, and we start presentations on
The 23rd.
the 23rd.
Okay.
See, that was strategic.
Well, yeah.
Yeah, no, and that's mean to have, okay, so you have to go not only for your presentation, but you have to do your Health in the News. So again, those people, there's been a couple of people who weren't able to present on their day, so they'll just be, put on a different day, but it won't be during presentations. Okay, so Josh had a question about being dressed professional. So I'm gonna be a little bit more relaxed with that. And you don't have to come in a suit and tie or anything, but I do want you to, what I would say is be professionally casual. Okay, so for example, I have a t-shirt on with a nice sweater over it. And then I'm definitely in my pajama bottoms, I'm gonna be honest. That's okay. So, it doesn't have to be where, and I know some instructors require that you come in with a tie or a suit. It doesn't have to be that way. Just, try to be more on the professional end of things. Okay. A nicely pressed t-shirt is totally fine versus the hamper t-shirt. Okay. All right. So let's see. It's 2:10, and I feel like I've overwhelmed you all with everything today, but I really want to make sure that we have good question and answer time about the presentations. So next week, I will not lie. We will be engaged throughout the entire course period next week. Our topic of drug education and so we're talking about alcohol, tobacco, and drugs. And drugs could be anywhere from Adderall to cocaine, which I guess are similar but separate, right? So we have prescription versus illicit drugs. That's a good 2-day conversation. And I want to make sure that we have a good amount of time for our guest speaker, and then we have other time to discuss other things. So what will happen for our schedule, I'm going to go back over here one last time to the syllabus, and I put this little catch-all here on November 16th. What will most likely happen is the drug and alcohol conversation will go into November 9th, and I'll do a little mini lecture for you. We'll probably even talk about it a little bit more on the 16th, and then I'll have the major and infectious diseases as a separate little mini lecture for things to focus on. There's not that much in that topic because we've been talking so much about COVID, but when we look at, diabetes, which we're looking at in our presentation, so I'm gonna not focus so much on that because we're getting that elsewhere. So you'll get the info, it'll just be more of the asynchronous class type information. Okay, questions, comments, thoughts? And please don't ever think that your questions are silly or that you have too many. I love questions because if you're thinking it, somebody else is. All right, so we've gone over Kahoot, we've talked about activities, and again with activities, I want you to be creative. Set up a activity where we can participate, whether it's Kahoot, because if everybody does Kahoot, then it's going to be redundant. And I know everybody's going to, but think about other things that you can do. The Zoom practice for the presentations is key, and the group leaders, I can't stress enough, you guys really have to keep on your members. And I don't really want to get any more emails about group members not participating. We're all here for the same reason. So put in the equal work. Okay. All right. Any other class questions? Exam number 2 is coming up. So exam number 2 is going to be the week of November 23rd, which is also the week of presentations. But it's going to be a end of the week exam like we did last time. So open Friday, close on Sunday, and I'll provide a study guide for you. And it's just going to be off of the topics since the first exam through that exam. So we're talking about nutrition, we're talking about drugs and alcohol and tobacco use, and then infectious disease. No presentations will be on the exam. Okay. All right, I think I have exhausted your brains enough today. Last chance, questions, comments, concerns. Okay, I'm gonna stay on for office hours, so if anybody wants to stay after and chat with me, whether it's in a group or breakout rooms, we can do that. I appreciate your time today, your comments, all that is really helpful for everyone to hear, so thank you. And next week, we are not meeting. Oh my gosh, we are meeting. My other class, we're not meeting. This is how quickly I forget. Next week, we have our guest speaker. So we're gonna be meeting 2 weeks in a row. And then we have a week off. So I will see you guys next Monday at 12:30. Hang out if you have questions. Otherwise, have a really great week. And don't forget to sign in the chat if you haven't done so already. Have a good week, everybody.
Thank you.
Thank you.